Ayurveda's advice on things to avoid in pregnancy. Traditional methods and age-old advice is based on years of observation. Ayurveda is one of the world's oldest holistic healing systems that was developed more than 3,000 years ago in India. It is based on the belief that health and wellness depend on a delicate balance between the mind, body, and spirit. Let's learn what Ayurveda recommends for the pregnant woman in terms of what are things to be avoided. Yana or traveling should be avoided. Travel as a whole should be avoided in pregnancy, but if necessary, at least it should be avoided in the first and third trimesters. A long distance travel on 2 or 4-wheelers or a long flight is discouraged due to the risk of clotting of blood in the veins. Any bumpy ride that increases intra-abdominal pressure is a risk. Travel in a pressurized aircraft is safe till up to 36 weeks. It is advised against in women who have placenta previa, preeclampsia, or severe anemia. Uttana Shayana, or being in supine position. Lying down sideways promotes a good blood flow to the uterus. What is not good is prolonged sleep on the back after 20 weeks of pregnancy. That may reduce the placental blood flow and lead to fetal hypoxia, that is lack of oxygen to the fetus. Supine position can cause lower back pain, swelling of feet, and pressure on intestines and the large veins, inferior vena cava, which can disrupt the circulation to the fetus. For the mother, it can raise her blood pressure, which can cause preeclampsia and fetal distress. Abhighat or injuries. Injuries to the abdomen, like falling to the front or a hard hit against something, can cause the placenta to get detached. Fetal and maternal hemorrhage can occur. Uterine rupture is also possible if there is a considerable abdominal trauma. And sadly, that could be life-threatening. Vegadharana, or the holding of natural urges. The Apana Vayu governs the downward and outward flow of energies within our bodies. Maintenance of normal functioning of the Apana Vayu is important in pregnancy. Holding it can cause various Vata-related disorders. Holding the urge for flatulence may lead to pressure on uterus, nauseated feeling, burping, and chest burn. Holding the urge for urination may lead to urine infections, filled bladder, and cramps in the uterus. Holding the urge for defecation may affect your desire to eat, causing anorexia. Rahu Darshan, or exposure to eclipse. Exposure to both lunar and solar eclipse could expose pregnant women to harmful radiations, leading to fetal defects and growth problems. Mansik bhavas, or stress. Stress and persistent negative emotions will lead to insatiability or excitability of the autonomous nervous system. If long and intense, it could harm the fetus. Stress disrupts the normal hypothalamic pituitary axis by excessive production of stress hormone cortisol. It also leads to reduced immunity. That is why the age-old recommendation is that pregnant women should be calm and happy. Vaivya, or sex. Even though normal coitus and exercise are beneficial, however, their excessive use of physiological strain may precipitate abortion, especially in women who are prone to the same. Sex during pregnancy, particularly orgasm, could trigger contractions. These contractions usually do not lead to labor though. There may be chances of early rupture of membranes through coitus in the last weeks of pregnancy. This may increase the risk of infection because there will not be any protective barrier. So sex during pregnancy, as per Ayurveda, is recommended only between weeks 14 to 28. Whether you are at the beginning or the end of pregnancy, remember to prioritize rest. It is truly a beautiful process and you need to honor all of your body's needs. By incorporating Ayurvedic practices into your pregnancy journey, you will feel in touch with yourself and your needs while nourishing the new life that you are bringing into the world.